we have one of the biggest people in Kenya because they are doing something that is big. I want to know what they are doing, and we're going to know that in a few. But in the meantime, acha tuangalie sura zao zinakaaje and what. Tutaanza pale from the lady. Madam, how are you?
Oh, fine, thank you. How are you?
Ekoaje?
I'm good today. It's a beautiful day.
Oh, okay. So unaweza ambia watu unaitwa nani, ni nini exactly umekuja kufanya hapa Top in Africa?
Naitwa Jepkoech, Delaviv. I'm a fourth year medical student at the University of Nairobi. I'm also a volunteer at RESPEKT, where we mentor students, young students, especially teenagers, on matters of reproductive health and sexual education. But we also want to talk more about youth empowerment and especially in governance. Yes, so that's majorly what we are here to talk about today.
When ni daktari?
No, I'm a fourth year medical student, so student doctor.
Yeah. Sir, how are you?
My name is Bidian, Bidian Okoth. I am the national coordinator for RESPEKT. So just support some of the activities that we do in high school, some of them that we do in the communities, and also in charge of conversations with government when it gets to youth engagement.
So no, in a line of what RESPEKT is, in just a nutshell, what is RESPEKT? And what's the full name of RESPEKT?
Yeah, so RESPEKT is RESPEKT with a K, stands for Reproductive and Sexual Programs for Kenyan Teenagers. It's a social youth movement for a generation that just seeks to inspire change, positively impact on lives. So it's just a couple of young people that are trying to talk to teenagers in an aim to end teenage pregnancy, early marriage, FGM, kama hizo. So most of them are in university and they are trying to give back to some of the schools that they go to, trying to motivate a lot of those teenagers and also work closely with policymakers in an aim to create some more conducive environment for the teenagers to grow up better and not face the same challenges we did during our time. Yeah.
Wow, nice. Della. So for how long have you guys been active? That is RESPEKT.
RESPEKT has been on for 9 years. I think Bidian has been there longer than me. Personally, I joined RESPEKT in second year, so I've been in RESPEKT from second year till now. But it's been running for 9 years now. Yes.
So what is that one thing that pulled you to RESPEKT as opposed to other organizations?
Okay, I think for me, RESPEKT, we go to high schools and talk to students matters SRHR, that is sexual education and reproductive health. And I think that is what, as a medical student, that is what drew me to RESPEKT, because now we get to engage with these students at the community level. You know, when most students are affected by there's period poverty, there's STIs, there's teenage pregnancies, there's a lot affecting the youth that we as doctors meet them in the hospitals. So it's easier when you go out there and talk to them, reduce these problems at the community level. Yeah, so that is what drew me to RESPEKT.
Oh, so basically prevention is better than cure.
Yeah, prevention is prophylaxis, yeah.
Okay, see, I'm catching up. So, and also in line, because you're a medical student, in line with RESPEKT is mostly what you're dealing with is health, that is reproductive health.
Yes.
Mostly in line with menstrual health, which is most ladies or most girls from, I'll say, marginalized
communities.
They don't have access to pads, also education for it. How are you making sure that these people, mostly kwa hii time economy stuff, how are you making that wamepata hiyo, if not getting the necessary resources, people out there wanawasaidia?
Oh yeah.
Della on you, Steve.
Oh, sorry. Yeah. So, okay, for us, we as an organization, we don't give the students pads like we go distributing pads. But what we talk to them about, as my position as a doctor, we'll talk to them about menstrual hygiene, how to keep clean during these times, and also sexual health, like, the importance of consent, so that they're not misused by, within the community. Okay. And also empowerment. We want to empower these young people at the ground level.
Wow.
Yes, so youth empowerment. So we don't deal with girls alone. We also interact with boys, because boys also need to be empowered.
They need to understand what also menstrual education is all about. Not only girls.
Yes.
So even guys, you're taking them and telling, oh, you know what? Don't laugh at a lady who is...
Exactly. So we are also aiming to reduce the stigma that is associated with menstrual health and everything around it. There's so much stigma around menstruation up to date, despite the fact that we keep talking about it. It's still there. It's still a problem. So that's what we are trying to solve for both girls and for both boys. Yeah.
Oh, Okoth. Okoth. And now let me get to you, because she has touched on reproduction health, and now we go to the governance, which it's some of the things that RESPEKT is doing. How are you able to give youth voice for them to be included in the governance? Government, basically. It's
one of the reasons why we wanted to come for this session here, because it's called Top of Africa. We believe that young people are on top of Africa right now, being the demographic dividend, and most people are being young. So what we're trying to encourage, particularly also through RESPEKT, we have around 140 volunteers that are young people, and we're encouraging other young people to share their opinion positively, and also know that their opinion counts. We are trying to encourage, create structures such that a lot of teenagers and young people in universities, they can be able to influence policy. So for instance, we conduct research works, we collect data, and then we meet policy makers. We tell them this is what young people want. I know it's a bit hot right now in the country with the finance bill, but as a project, we also had a memorandum submitting that we don't want the government to tax sanitary towels. That young people are not comfortable with the government taxing pads. So things like that, we make sure that young people are listened to. But down even in high schools, we want the teenagers to be used to the notion that they can suggest something, and whatever they have suggested has a real chance of influencing what decision is made by the school.
So basically you're molding them at a young age to be included now in the government. And you have to show them this is what, when you were growing up, we didn't get such opportunities, but now here we are, it's RESPEKT, we are showing you this is the way forward.
Yes, this is shaping the hearts and minds of the future of the country, making sure people are emboldened enough to say no, to say yes, and also to say when things are not working out for them.
So are you a Gen Z? Because what you're saying basically is what we are seeing, the Gen Z movement. We want to talk, we want to say, are you a Gen Z? Am I by association, affiliation, inclusion?
Yes, I would like to call myself Gen Z, but I'm just out by 2 years. So I'm a Gen X. We are the millennials that are trying to work closely with the Gen Zs. But my colleague here is a Gen Z.
Nice. Yeah. So also before you pass the mic before you pass the mic, the question that mostly that hinders a lot of youth is space, to get a space where they can be able to talk about the things they want. And now using the hotness in the country and the police and the government, and now here the youth. So which is that thing for having worked in RESPEKT for 9 years that you've seen, you probably thought that would come, but imekuja mapema, imekuja ikiwa imechelewa?
Yeah, I think one of the biggest conversations that when we were starting RESPEKT, I also am an alumnus of KU. When we were starting RESPEKT, we used to meet in the student hostels and in the halls, and trying to discuss some of the things that we would want the government to change. And what surprised us, just 4 years in, a lot of our young people within RESPEKT, they are 25, 26. They're already being called into some government meetings with the Kenyan Institute of Curriculum Development to discuss the CBC curriculum. When the government was discussing the budget for the Ministry of Health, the higher level, it's the high level meeting for the Ministry of Health. We were also invited to some of those discussions, and it's encouraging that we can be in that space and share. And what surprised me is how much young people are not represented in those spaces. That the thing that is needed is that somebody else there is representing young people. So we are not representing ourselves in the meeting. But people have always just thought representation is through the election, that the MP should represent you. But when the government is making policies, a lot of NGOs, civic society organizations, interested groups are invited, and those are not politicians. So there still exists a lot of room that young people need to participate in. I have been part of a lot of discussions, of course, on the government side and also with civic society organizations. Recently, we just came from Mombasa with all the NGOs that are working on reproductive health, and RESPEKT being a youth-led, youth-run organization, being in the same seat with Plan International, Ministry of Health, discussing what is challenging young people. It's something that encourages us a lot, that maybe whatever we are saying makes sense, and that it is important that people consider what we are saying as a serious concern for young people. So that has been impressive for us. And of course, we're looking forward to more, like send petitions to Parliament, help submit some of our research work that we are conducting as a project, and also encourage other young people to be able to just say, if the government says they're providing youth-friendly service in a hospital and you go and they're not offering it, we want the young people to have the confidence of saying, tulienda huko, tukupata mtu. So we are requesting ule mtu lieka pale ni mzee sana, we are embarrassed to talk about STIs and stuff. So unaweza tuwekea kijana kidogo, somebody we can share a little bit more openly
in our language and in our lingo.
Because I've been in those clinics and somebody brought their colleagues and then said, daktari huyu anaumia huko chini na hasemi. Because they're embarrassed to talk to this very old medical practitioner. But if they brought a younger person, they would tell them, hey, huko chini kuna vile usiku kuna nuka, so naweza nisaidia sijui kunaenda aje.
True.
And people are able to share more openly.
Wow.
And within that. So that has been something that really encouraged me to move forward.
Wow. Dela, on your end, you're a medic student. Which is that one thing that you found that people don't really talk about, but RESPEKT is advocating for?
People don't talk about sex. When you talk about sex, people think it's this, what is this? It's a controversial topic. I have an example. Okay, so in RESPEKT, we attach ourselves to schools. We go to schools, then we talk to those students. But before we go to those schools, we need to talk to their teachers so they can be able to know, they are comfortable having us in their school. But now I have an example of this school where we went requesting for their permission to interact with their students, we inculcate our club in the school. But now, because after going through our curriculum, the teacher was like, no, we don't think we want to have such a program in our school. So akatupea a long procedure of which other schools didn't give the same, other unis the same procedure for the same thing we were doing. So our take-home message with that was the teacher didn't want whatever we were talking about, like, sexual health and the importance of reproductive health and consent, everything too surrounding reproductive health. That teacher did not want us being there talking to their students about it. And I think, personally, I didn't feel good about it because the schools we choose, these are the schools in those communities like Kinakibera, Madare. So those are low-income communities. People there are facing these problems. These are problems which are there in the community. That's why we chose these schools. But because the teacher feels this is a very controversial topic, now they're not going to allow us to come to the school. And now what happens is these students will not be able to benefit from the mentorship we were aiming to give them concerning those topics because the teacher thought it was a controversial topic. So but in RESPEKT, people, it's inclusive. Like when you Bidian amesema, when you make these topics easy to talk about, people are more likely to engage in them because people are like sexual and reproductive health. So what comes to their mind is we are coming to school to tell their students to have sex, which is not really the case. We are coming to school to talk to teenagers about the importance of consent and things that they shouldn't be, like there are things they go through in the community that they don't know it's wrong. So we are mentoring them and telling them that this and this should not be happening. Like you're a young person, this and this. So importance of consent and everything.
Wow.
So reproductive health is a very controversial topic, and in RESPEKT, we encourage talking about it to make it an easier topic because kids uko Kibera, Madare, they're victims of gender-based violence, HIV and AIDS. Sahi kwa watoto Nakuru, like between 15 and around 21, the HIV
rates
rates are increasing.
Wow.
So and we are aiming to reduce that through spread of information. But
you have to start from somewhere.
We have to start from somewhere.
So passing the mic to Bidian. Now, if someone, you said you have approximately 140 volunteers. If someone want to join your team, do you have a way of how you filter these people, or anyone can just join your team?
A lot of people that join our team are university students that are studying in any of the medical schools, any school that has a medical school, pharmacy, nursing, medical lab, also public health students. They're able to apply to join our aim.
So the first catch is you have to be in a medical school.
Yeah, you have to be part of that so that you can join, because then we are hoping you have the bare minimum knowledge in case the teenagers are presenting with some kind of complications. Some of those teenagers, when they come to us, they have gone and procure an illegal abortion, and then they're facing some complications. So as they are talking to you in confidence, you can you don't need to take so long before you can relate. They're like, they're talking around this and this, and we're able to do a proper referral for them to get a proper medical care. So those are the people that mostly apply, and they can join. We just recruited 54 more members recently.
Wow. And so where do they apply? specific.
So every year we do announce on our social media platforms call for new members, and then members are able to apply. And it's very key to remember that when people join us, they are volunteers, but we are fully funded. So our volunteers do not incur any expense to being. So we do provide all the support, the transport, the airtime, the meals, the accommodations that are related to any activities you do in our project. We will cater for it. But that also means we reduce the number of people we can take because we need to be able to cover you 100% for all activities when you join us.
Oh wow! So and if someone is not in a medical institution but is interested in joining, do you have like a special program that you offer?
Yes, we do have through our advocacy team a community engagement program where we have some funds that are put aside to do community sensitizations. So those who are interested, they can come together as a group and then they partner with RESPEKT. We will still support 100% those activities. So they're not necessarily RESPEKT members, but they are doing RESPEKT activities in the community on our behalf, working with a few of our members to educate people within the village, the communities, the universities. So it is still possible to do RESPEKT activities without being a RESPEKT member.
Nice.
For a lot of our members,
Okay, so Dela, as a Gen Z, tell a message to a Gen Z out there who is feeling, I need a space to talk, I need a space to be encouraged. What is that one advice you tell them as a Gen Z?
Like a space they need to talk?
Yeah, space. So assume you are the space. Now, what is that one thing you tell them?
Wait, I'm not getting your question. Sorry.
Okay, I'm saying you're the space. That is RESPEKT, a representative of RESPEKT.
Yes.
As a Gen Z, what is that one thing you tell a Gen Z out there who needed a space?
Oh, yes. So at RESPEKT, we don't judge. We don't judge at RESPEKT. And we handle a lot of topics that out there, they're genuinely controversial to talk about. Kama the example Bidian has given on abortion, like someone goes and procures an abortion that is not safe. Which if we are being genuine with ourselves, these are things that genuinely happen out there in the community, but people don't want to talk about it because of the stigma that surrounds it. So in RESPEKT, it's a very safe space. So we encourage people to come, and young people especially, to come share their stories with us so that we can talk to them, encourage them, mentor them, and most especially we don't judge. We talk about everything, literally we talk about everything in RESPEKT. So it's an open space, and the good thing is you can also find we have what are these called? We have social media spaces where we invite young people to come and talk to us, to tell us their stories. And also in our social media, IG, Twitter and TikTok, tuko na hizo, we make reels that are relatable to young people. So that's how we get to reach young people. So I think that's also a space where they can relate to things they can relate to.
So exactly mention the handles for the socials and the contacts.
Oh, okay. All our social media handles, it's RESPEKT-KD. RESPEKT with a K. RESPEKT-KD. Like dash the sign.
Dash.
The sign. So RESPEKT KD. And we also have a record with a REKORD. Record program. Also, that's how it's called in IG. Record, where now students can come and talk about their spaces. Their issues.
Wow. I know this is a very soft, I'm not used to having soft topics. I'm used to dancing, enjoying this moment, but I understand these are things that we need to talk, and it's a safe space, and I know if we had more time, something that we can talk about, but also we are going to connect with you in your spaces. That is RESPEKT_KD. Go connect with them. Check their project. If you're a medic, and pale tell them, you know what, nimefanya course ya medicine, nataka kujoin. Go connect with them. Also, if you're not a medic and you want to join, still they are open to have campaigns with you, because tunajua si lazima uko unajua udaktari ndo uweze kusaidia mtu fulani anaumia hapo mtaani.